Hey, and welcome to the Mastering Blood Sugar podcast. It's Dr. Brian Mowll, the diabetes coach. And with me today is a registered dietitian named Temple Stewart. And Temple has an interesting story. She's not doing what I would say the majority of dietitians are doing today, especially in the diabetes space, which is following the American Diabetes Association guidelines and the dietary recommendations, insulin and blood sugar management suggestions, and so forth, which ends up just being a lot of medication management, unfortunately, and diet advice that I think is geared towards, what are people going to do? So what's the low-hanging fruit? No pun intended there. So you've taken a different approach, and I'm really interested to learn a little bit more about your story, and then glean some of your wisdom, your advice on what people can do, women especially, to improve their blood sugar, metabolic health, and insulin sensitivity. So Temple, welcome, first of all, to the Mastering Blood Sugar podcast.
Yeah, thank you for having me. It's an honor, truly.
That's great. Thanks for saying that. So ketogenic nutritionist, and by the way, if you want to learn more about Temple, I'll mention it a couple of times, but Instagram is a great place to go. The ketogenic.nutritionist on Instagram. So check her out there. How did you become the ketogenic nutritionist? How did you get into ketogenic diets, low carb diets, that type of thing?
Yeah, great question. So, I think it started out just like a lot of people who find themselves in the low carb space is I was having my own health issues. I grew up in South Mississippi, ate a lot of rich foods as a kid, and kind of was always the bigger kid of the friend group. And I didn't think anything was wrong. My parents didn't think anything was wrong. That kind of went into college. I was an athlete in college. So I played soccer for college. And I think a lot of the excessive exercise masked a lot of what probably would have cropped up much sooner for me. I didn't really initially have an interest in nutrition until I really started having like significant problems with my weight as a Division I soccer player. And I'm thinking in my head, I'm lifting, I'm running all the time. Why is weight an issue? I'm exercising 10 times as much as the average person, And so that's when I started to really think, okay, maybe it's what I'm eating. Maybe I'd like to learn more about this. And so that's when I started pursuing a degree to become a dietitian. My sophomore year of college, I lost my cycle altogether. And that was, again, another red flag to add to all these red flags that were going on. And so I did the typical thing, like go see an OBGYN, got on birth control, did the normal treatment for what I now know was just a significant case of PCOS. And so I followed that route. I became a regular, dietitian in conventional medicine. And I was taught everything that dietitians continue to taught or learn. Lots of carbs, lots of whole grains, lots of legumes, this kind of thing, low saturated fat, all of it. And so I took that from college, still having a lot of issues with my own health and weight and cycle and everything. And I ended up working at the VA hospital in South Florida. So I was a clinical dietitian. I worked in the diabetes clinic. And here I am trying to help these people lose weight and manage their diabetes, manage their metabolic issues and hypertension, all of it. And I can't even lose weight. I'm pushing 200 pounds at this point. I'm uncomfortable in my own body. I had just gotten married, and this is supposed to be the time of my life. I'm in my early 20s, and I just could not figure out my own health, and I felt like a total imposter. I'm a dietitian telling people how to be healthy, and I feel like a mess. And so that's when I ultimately started to reach for things that had not been tried before. So I had basically tried everything that conventional medicine had taught me to do, lower my calories, exercise more, eat more whole grains, lower my saturated fat, avoid animal proteins, all this stuff. And looking back, it really just exacerbated the blood sugar issue for me. And that's when I got pretty desperate, to be completely honest. I had just gotten married and I really wanted to have children. I wanted a family. I wanted all these things, and I just couldn't get myself together. And so I started reaching into the kind of what we would call the alternative medicine, functional medicine, whatever you want to call it, realm. And that's when I got my hands on a couple books that really significantly changed my life. One being Why We Get Sick by Dr. Bickman, The Obesity Code by Dr. Fung. And that's when I thought, you know what, this is controversial, or it's contrary to anything I've ever been taught, but I'm going to give it a shot because what do I have to lose at this point? And within, a month, my cycle had returned. I'd lost about 12 pounds the first month, and I didn't really even know what I was doing. I was just trying to figure this out. And so that's when, kind of the light bulb came on, and I just haven't been able to turn it off since. And it just made such an impact in my life. I started using it at the VA, and that's when things really, really were eye-opening. My veterans that had been on, diabetes medications for 20 years were lowering their insulin, cutting their insulin in half, getting completely off oral agents. It was just unbelievable the results I was getting teaching this alternative method that I really hadn't learned much about in school. I just couldn't stop. And so, doctors were sending me their patients from across the state. Like, it was just this bizarre thing where people were getting results that they hadn't been able to ever get. And I just couldn't, that's ultimately what made me create my own private practice and kind of get out of that diabetes model that just, in my opinion, isn't super effective and worsens the disease state altogether.
Wow. So incredible story. That first month you said where you lost, I think, 12 pounds and started to turn your health around, what were the big changes you made there?
I honestly just kicked the conventional dietitian model out the door. I stopped worrying about calories, and I stopped trying to eat all these whole grains and beans and all this stuff. And I really focused heavily on protein and non-starchy vegetables. And, one of the first things I realized is my appetite was just not as up and down and all around and kind of crazy. I had a lot of problems just controlling, sweets cravings and things that shouldn't really be a problem if you're getting enough protein. And so I would say that was the biggest thing I changed, is I stopped eating these quote unquote healthy whole grain-ish type carbohydrates and a ton of fruit and all that. And I really focused on satiation and protein and, fat. And I just found that it came easy. I stopped tracking. I had a significant history of tracking calories that just didn't help at all. And I threw that to the wayside, and I just started seeing immediate changes in my mood and my energy and my sleep. But most of all, I could see physical changes happening on my body and inside it. So it was crazy. My cycle returned very quickly as well, which was another kind of indicator whoa, I'm on the right track. That's one of our best markers of health as a female. So yeah, it was really eye-opening. Within the first couple months, I was just completely shocked.
Were you trying to eat low fat before, or you were just doing more of a whole food diet, which included healthy fat?
Yeah, I would definitely say I was worried about the fat content, specifically saturated fat, because that's what's hammered into our heads when we're becoming a dietitian. Right. And so I was, purposefully picking low fat foods. I was purposely choosing lean cuts of meat when I would eat protein and things like that, where I was always looking at the fat content. In hindsight 2020, that's why I had so much problems with my appetite and why I was having all these crazy cravings and likely hormonal issues as well. And so, yeah, I definitely was concerned about that.
Okay. And so how long ago was that?
Oh, that was about 6 years ago now. Yeah.
Okay.
6-7 years ago.
So how have things changed for you over the past 6 years? Have you stayed on that sort of initial diet? Has that evolved for you? Have you been able to add back in, certain carbohydrates, or what are you doing now, and how did your diet evolve?
Yeah. So initially I would say I was extremely strict. I was well within the ketogenic macronutrient parameters, and was even tweaking that as I went, probably higher fat and protein. But yeah, it's kind of just morphed itself into where my health is now. So when I started, I was pushing 200 pounds. Now I'm around 130. So my carb sensitivity is I eat fruit occasionally now and don't worry about the blood sugar spikes, because I do it in a way that, my tips and tricks beforehand aren't going to cause those spikes. So I would say I've been able to be a little bit less rigid these last couple years because my labs are fantastic. I'm no longer battling this weight that I initially battled. And, in the beginning when I first started, I had pre-diabetes. I had all these markers that were screaming red flags that my body just was not tolerating carbohydrates well. And now I don't have any of those. You know, my A1C is like 4.8. My insulin hovers around 3 to 5. You know, all the triglycerides are 60, 50, 60. So like all these things that were initially not the case have just completely changed. And so I do occasionally eat fruit now, but I'm also much more muscular. I do occasionally eat fruit now, but I'm also moving throughout the day, and I try to have protein beforehand. So I'm doing all these things that protect me. So when people ask what's my current diet like, I would say I'm like 60 to 70% low carb keto. And then the rest of that, I'm having whole food, real food types of things, you know, occasional starchy vegetables, occasional fruit here and there, because my body handles it well.
Yeah. And I think that makes a lot of sense. We often teach that the things you have to do to regain metabolic health are not always the same things that you need to do to maintain good metabolic health. And many people will have more flexibility once they're already once they become metabolically healthy. And there are people who don't lose their metabolic health, you know, who are able to maintain a flexible diet. But like, you had to go through a period of time where you became very strict, had to lose a lot of weight, reduce inflammation, make a lot of changes, break through food cravings and addictions and all that stuff to be able to get to a place where now you have a bit more flexibility in your diet and your body can handle it.
Yes, correct. That's exactly what happened. And that's what I see in a lot of my clients. And I know you're doing this as well, so I'm sure you see kind of those same changes, but it's when your body's operating correctly, when your hormones are on board operating correctly, it does allow for a little bit of variety and flexibility.
Yeah, perfect. So you work mostly with women, and people listening to this, I think, you know, men and women are going to gain a lot from it, but we'll steer the conversation towards some women's health issues because that's, I think, what you see mostly in your practice. And also you have a history of PCOS. So I'd love to start there and talk a little bit about PCOS and how it's connected to metabolic health and insulin resistance. So maybe, you know, what is the condition and what is that connection to metabolic health?
Yeah, that's a great question. One, and as your listeners probably know, PCOS is like the number one endocrine disrupting thing that causes infertility in women. And it's such a heartbreaking thing to go through because, you know, if you want children or even if you just want your hormones to work correctly, it's very, it's just demoralizing over time. And so, and I think we approach it in a lot of the wrong ways. We slap a lot of Band-Aids on it, but we don't teach women like, okay, here's the root cause of this. If you want this to be gone for life or you don't want to deal with this is what we need to do. And so I think to put it as simple as possible, PCOS is like diabetes of the ovaries in most cases. Now there are variations, et cetera. We could say that for another day, but the vast, vast, vast majority of PCOS is due to insulin resistance related problems. And so I think that's really important for people to understand is that the more we try to treat it with Band-Aids, it's just not going to go away. And so that's pretty simple is diabetes of the ovaries. And I kind of explain it to my clients as it's like insulin is like the hormone way upstream. And once it starts getting dysfunctional, dysregulated, however you want to describe it, it starts to pollute things down the stream all over the place. It starts to mess with your androgens and everything else starts to get dysfunctional. And when people initially learn about PCOS, they start to learn about, you know, your testosterone's high, your DHEA is high, and they start to spot treat these certain hormones. When in reality, if we just went upstream and cleaned it up upstream, a lot of these hormones will regulate on their own as you get it in the right environment. And so that's what I did with my own treatment. And that's what I try to do with my clients is really try to treat the problem at the root. And then therefore these symptoms of the facial hair and the loss of the hair on the head, and women will get cystic acne and they'll get this PCOS belly that's nearly impossible to go away. They'll start developing a lot of the symptoms of insulin resistance, and it essentially will stop your cycle because of the hormonal fluctuations and cause amenorrhea and all this other stuff. And so again, I want to put a lot of hope out there because a lot of people see a lot of symptom reduction and complete, whatever you want to call it, remission or however you want to describe it, when they start to treat the root cause of polycystic ovaries. And so anyway, that's a short and simple way to put it, but it's great.
Yeah. And I think one of the keys there, that many people still don't quite understand is that in insulin resistance, we often have elevated insulin. And that's not going to be new to some people, but for some people it might be. And the elevated insulin is one of the things that triggers the ovaries to make more testosterone, the androgens, which can cause a lot of the symptoms, right? So we see high insulin driving all sorts of problems. It can cause problems with the endothelium, the lining of our blood vessels, leading to plaques, which can cause heart attacks and strokes. It can certainly affect our blood pressure and fluid retention. And, growth factors, insulin's kind of a growth hormone for the most part. So we see growth factors increase with high insulin, which can lead to cancer cell proliferation and other things. So the elevated insulin that's associated with insulin resistance, I think, causes a lot of these problems. And so that's something that we need to really be paying attention to. Is that something you talk about in your practice or have people go get tested, or how do you bring that into the conversation?
Yeah, for sure. I think it's one of the markers that we have completely missed as a medical society that should, without question, be tested yearly and way earlier than it's baffling to me that a lot of people don't even know their fasted insulin, and I like to know it in connection with other things. Like I like to look at glucose and A1C and insulin and HOMA-IR and triglycerides and elevated liver enzymes and all these other things. So yes, I absolutely think it's a marker. I like C-peptide as well if I can get it. But when I work with my clients, I pull it's about a 70 biomarker panel, and it includes the stuff that just isn't being pulled on your regular yearly exam. And now things are getting so much easier with, cash labs and things like that we can get this information. And the other thing too is our ranges are so high that, they'll allow people with a high insulin to go up to, 16, whatever it is that it starts to become abnormal, maybe 18. You probably know better than me, but it's like, no. We prefer to see that closer to, 4 to 7, or there's debate on that, but it's way lower than we typically see and diabetes management and PCOS management and all of this. So yes, I like to look at these labs in all together and get a really good baseline of where my client is when I start to work with them. Also, so we can monitor them. Is this working? How are they doing? Is there other factors at play, like your cortisol and adrenaline, these other hormones that can sometimes drive some of this? And so yes, to answer your question in a long-winded answer, I think these labs are vital. I think if you care about disease prevention long-term, you got to know these numbers. And I think it's a huge miss on the medical community that we allow patients to leave our office without knowing some of these values.
Yeah, absolutely. And I'm glad you mentioned C-peptide. C-peptide is an important test that is ordered even less often than fasting insulin. A lot of sort of more functional medicine-oriented practitioners have started doing insulin, but still very few of them do C-peptide. One of the challenges is that insulin gets degraded, and the liver, especially after a meal, the liver will break down a lot of insulin pretty quickly. So it's not always perfectly accurate, especially in a post-meal window, to test insulin. So I do think we should test it, but C-peptide can sometimes give us a more accurate view of our production of insulin. For those of you who don't know, it's basically a fragment that combines two insulin molecules that come out of the pancreas. So when those break apart, there's a peptide called C-peptide that you can trace in the blood that tends to track pretty much one-to-one with insulin production. So important marker to look at. So you do a lot with insulin resistance. What are some signs or symptoms, especially in women, that someone might be insulin resistant? So if they're having some challenges and maybe they're having a hard time losing weight or something, and they haven't necessarily had the blood work done yet, what are some things to look out for?
Yeah, great question. So I start to have hesitations or red flags when people are complaining of that weight loss resistance, especially in kind of the belly area, the place that we know it's hormonally driven. I think some of the skin manifestations of insulin resistance are important to talk about. The acanthosis nigricans, the skin tags that are popping up in the crevices, some of those things. I also look out, obviously, because I've had PCOS, is some of these cystic acne and very oily skin and hair loss where it's not supposed to be losing and hair growth where it's not supposed to be on a female. And so, I take some of those physical symptoms in line with a lot of the lab work, the creeping fasting glucose, the creeping triglycerides, the creeping liver enzymes, things like that, where it's like you may be developing an issue. I also like to watch this as women go through the stages of their cycle, reproductive and peri and menopause. As we know, those can affect a lot of these hormones as well. I think talking about some of the other symptoms in terms of like the getting hangry and feeling shaky when it's not appropriate, or feeling like you always need to snack, or feeling like you always need to have something sweet after a meal, never really feeling satiated is another thing I hear a lot of my clients say, is like, I just have eaten this large meal and I just don't really feel super full. Is one I see often. Mood swings can accompany insulin resistance. Like you said, it's tied to such a plethora of conditions that really nothing's off the table in a lot of ways. But I look at some of those physical symptoms, some of those mental health, and then some of those food behaviors as well that can kind of set off some red flags in my head that we might be headed in the wrong direction in terms of insulin resistance, metabolic disease.
Yeah, really good ones. And I like the idea of not feeling satiated. So because we see that often. How does insulin resistance lead to that? How does insulin resistance affect our appetite or affect our food cravings?
Yeah, there's a couple ways. I think bringing the GLP-1, stuff like that, into the conversation hormonally is important. So that's satiating all of that. I also think it's important to talk about the just increase and decrease in blood sugar itself when your body's trying to maintain homeostasis with that, and you're sending your blood sugar high and then it's rapidly dropping. Your body's uncomfortable and it's a little bit stressed out. It's going to send out those signals like, hey, bring this back up. We want to maintain blood glucose levels. And so it does a lot of that as well. And then, like you mentioned, insulin tends to be building or fat storing, however you want to appropriately name that, its actions. And so it's kind of constantly in that storage, quote unquote, state. And so you never really tap into the fat cells that you've already put energy into. And so I think there's multiple ways. And I think women a lot of times feel these first in some cases. And so, yeah, you'd probably do a better job explaining some of the hormonal effects of that, but it's extremely common to see those food behaviors.
Yeah, I think you made a really good point there. Insulin is an anabolic hormone, so it wants us to grow, and so it stimulates appetite. It blocks thyroid hormone to a certain degree. It blocks other hormones in the brain which make us feel full and satiated. So it has a wide variety of effects, and it's a very powerful hormone. So it can override a lot of other things that would make us feel full, because it's such a primitive, important driver for human survival and human growth. So I think it's because of that, if we have too much insulin, I mean, of course we need insulin. Without it, we would wither away to nothing. And people, untreated type 1 diabetics, for example, do exactly that. So we need insulin. It's essential for life. But when we have too much of it, it's too much of a good thing. It can cause problems. So what are your favorite methods, or some of the most effective methods that you found to help women with insulin resistance?
Yes, I would definitely say controlling what we're eating would be my number one method. I think it's very challenging to do anything else until you've got the food under control. And so if I could say like the top three things I would tell someone, first and foremost is we need to get you satiated. So we do that with a combination of protein and fat. So, animal proteins, etc. I think removing some of the foods that cause that extreme spike and then following dip, you're thinking of your ultra processed carbohydrates, things of that nature, get those out. And then adding a lot of fiber and some people can tolerate a lot of fiber. Some people can't. When I talk about fiber, I typically talk about it in the context of non-starchy vegetables. So lots of green leafies, lots of the vegetables that are essentially aren't, potatoes. And that's really, there's several more, corn, etc. But your green leafies, etc. And then, so fix your food. Obviously getting rid of things that I would hope would be obvious in a lot of ways, but like sodas and sweetened coffees and things that really, really send sugar high. Second, I would say women have got to prioritize building muscle. And this is something that gets put on the back burner often, but muscle really does manage glucose like the most effective. And so it's really important. Women often think they're going to get bulky. They feel intimidated by the gym. They feel intimidated by lifting weights, etc. But whatever someone can do to build as much lean muscle mass as possible, I think is a huge and critical component to this whole chronic disease management and weight loss in general. And it's a piece that we often forget about or don't prioritize, but I would encourage people to do it. And then I would definitely add on to this is stress and sleep. This is often something that also gets put on the back burner. I think women tend to care for their families or do other things and just kind of sometimes forget to care for their own self. And so can lead to extremely stressed out lifestyle, very high cortisol and not a lot of sleep and all these other different factors that weigh into that. And so I think that's an important piece of this puzzle too, is making sure, you're taking time to de-stress, whatever that looks like. You're having healthy sleep habits, getting out of the LED lights, getting off the phone, getting a routine habit, getting outdoors in nature, all of that stuff plays a big role as well in all of this. And so I would say those are probably my top three when I'm addressing women. I also use supplements. So I'm not afraid to put someone on dihydroberberine. I'm not afraid to use magnesium or inositol in the case of PCOS clients. It kind of just depends on what lab values say for my supplement recommendations. But some of those are extremely helpful and I'll use them if I need to.
Okay, great. Let's talk more about supplements in a few minutes, but I do want to reinforce this idea of building muscle in women. I see this as well a lot. I had actually a new client earlier this week who was very frustrated because she was wearing a CGM and her blood sugar would spike after meals. Even like pretty healthy meals, it would go up 50 points. And, if she dared to eat, some sort of processed refined carbohydrate, it would go up into the, 200s. But everything else looks good. Like her A1C was pretty good, like I think 5.8. So not great, but, not in the diabetic range. Her fasting blood sugar was like like 108 or something like that. And all her other labs look fantastic. Liver enzymes were low, all the kidney tests looked good. Her lipids were good. Maybe just a slight amount of inflammation. There were some small things, but as I looked at her case, what became really apparent is that she was very small and very under-muscled. So I think she only weighed around 110 pounds, and I can't remember her height, but that was like really low for her height. And so she didn't have a lot of fat on her body, but she also didn't have a lot of muscle, and her body just didn't have anywhere to put the glucose. Now there's some genetic factors at play as well, I'm sure, but if the fat can't store a lot of glucose for whatever reason, then it's all going to go into the muscles, a little bit into the liver, but most of it into the muscles, especially after meals. Pretty much all of it's going to go into the muscles, like 80+%. So if the muscles aren't great at storing glucose because they're insulin resistant, or if you just don't have enough muscle in your frame to burn the glucose and store it, then you're going to have this high post-meal glucose spike. And that's what we're seeing with her. At least that was my interpretation. And so that's exactly what I recommended to her. And I'm going to try to work with her on is we've got to get you building some muscle. So I think, a lot of people come to me, probably come to you also, who are already doing a lot of good things. They've cleaned up their diet. They're walking after meals. They're taking some supplements already. They're doing a lot of this stuff. But one thing that you can look out for, if you've tried a lot of other things and you're still getting especially high blood sugar after meals, is this amount of muscle. How much muscle do you have on your frame? And so what are some ways that women can build more muscle? I mean, obviously it's going to be resistance training, but what are some of the strategies that you've found work best?
Yeah, I just say start low and slow, like wherever you are in your fitness journey. I had a huge history of weightlifting in college and through sports and stuff. But even then, sometimes you just need to start where you are. And so first and foremost, too, I like to tell people if you have access to it or you can, get an in-body scan or a DEXA scan, both really good measurements of how much weight, fat mass compared to muscle mass you're carrying to get your baseline. And so I like to, if people have the means, please start there. I think it's a good idea. And then really just start where you are, what you can add in. A lot of people get super intimidated with muscle or building muscle, and they think, oh, I've just got to go join the nearest CrossFit gym and I've got to do this for an hour and a half every day. And you really don't. You can really get away with like 20 to 30 minutes a couple times a week, and then focus on making those weights heavier, and you will see pretty decent gains and muscle mass gains. And so I use several free resources, and these are available to anyone listening, but like the Nike Training Club is a great app to use. Fit On is a great app to use. There's a zillion YouTube videos out there. If you're not comfortable going to a gym, do this in your living room. Like, I don't care how people do it. I just want them to find something that works for their schedule, especially if you're a mom or you've got a lot going on, there's a lot of work pressure, whatever. And just start low and slow, set your goals for a couple times a week, even 15 to 30 minutes, and build up from there. And most of the time we don't have to set further goals because people are realizing, I feel so much better. If they're wearing a CGM, they see these massive changes, like you're saying, the stabilization of blood glucose. And so I tell people to do that. And I do think it's important to understand for women to know too, you're not going to get crazy bulky. You're not going to see yourself have all these issues, and you'll feel good. And you're also going to be protecting your bones by doing some resistance training as well. And so there's just so many benefits there. But yes, start low and slow, start with what you can, and don't feel this intimidation and pressure and all this other stuff that we sometimes psych ourselves out of even getting started with it.
Yeah, it's great advice. Body weight exercises work well to start with. You can use some small dumbbells, and then you, like you said, you work up to put, higher and higher weight and start to build the muscles. And most women just don't have the hormones to, you're not going to look big and bulky. It's just not what the body produces. Many men have a hard time getting bulky even if they want to. So it's a lot, I guess, more difficult to get that way than most people think it is.
Yeah, for sure.
Yeah. So, okay. What about food? You do a great job on your Instagram page, I think, of showing examples of things, but what are some of your go-to meals that are easy for people to start with?
Yeah, so I'm a huge fan of making this as easy as possible. I'm in school, I've got kiddos, I'm a wife, all the things. So this does not need to be a 5-course meal 3 times a day situation. So I do a lot of like chicken salads and egg salads. And I typically recommend people just prep your protein first. Find a day that works for you, whether it's the weekend, whether it's a day that you're off, and prep a lot of protein and or get some convenience proteins like already hard-boiled eggs or rotisserie chickens, things that you can grab in a pinch. Most of the time I find when people prioritize protein and have that readily available, they can create a quick meal with using that. I tell people, don't be afraid of frozen vegetables. A lot of people think frozen vegetables are inferior to fresh. If you can do fresh, absolutely do that. But frozen vegetables are picked at peak ripeness. Throw them in your freezer quickly, heat them up in a pan, and now you've got your already prepared protein and a set of frozen or servings of vegetables. And so make it as easy as possible. I'm a big fan of using some of the keto foods that have come out now. Certainly put a flag on this because not all are great, but I love the Egg Life wraps and I love base culture bread, and finding some of those things that you can swap in and out for maybe foods that you're used to eating or whatever are really great. And so I do things like that. I eat a lot of eggs. I really focus on protein, and then kind of everything else kind of falls in line. I encourage people to formulate your meals in a way that's not gonna make you need a lot of snacking. Like, get enough protein at breakfast, lunch, and dinner that you're not constantly thinking about food in between meals. Is some advice I typically give. If someone's looking for some ideas like immediately, I like Carb Manager, the app Carb Manager. I think they have great recipes. I use a lot of their stuff, and just calculating macros, I think for someone getting started is a good idea there as well. So that would kind of be like the broad overview, is just really focus on protein first and then fill it in with a non-starchy vegetable. I'm a huge fan of I make like 8 to 10 of the same salads, and I just have them on repeat, just a big pile of non-starchies with a heavy piece of protein and some healthy salad dressing fats. And it doesn't have to be quite as complicated as people think. I've had clients that have found success using something like Factor meals or some of these other prepared that don't have seed oils and all the other stuff, and obviously don't heat it in plastic, but you can figure out a way that fits your schedule and your life to do this. So that was a little long-winded, but those are some of the things I find myself repeating most often.
No, it's great advice. And then for supplements, you mentioned something about labs and supplements, but how do you have a few go-to products that you like for people? Again, we're talking about people who have insulin resistance, or, maybe they're pre-diabetic or type 2 diabetic or need to lose weight, that type of thing. In that sort of metabolic dysfunction spectrum, PCOS falls in there as well. Are there some go-to supplements that you think most people should be taking, or how do you determine, which products to recommend to certain people?
Yeah, totally. So first I would say just obviously with any of the supplements, you have to be kind of cautious. If you're already on diabetic medications or hypertensive medications, don't go buy everything I say and then start taking it immediately and have an issue. So be cautious if you're already on some of these medications. But some of my favorite ones, and I've seen that are most effective. First of all, most women are low in vitamin D, period. So I find myself recommending a D3 plus K2 very frequently just to get the vitamin D levels back up. And then I would definitely say dihydroberberine. I'm a huge fan of dihydroberberine. I originally used regular berberine. It has a lot of the same, I think it is actually the direct same mechanism as metformin. You may stand corrected on that one, but dihydroberberine works very well for managing some of this. And dihydroberberine also doesn't have a lot of the GI effects that berberine does. And so I find a lot of people see very good glucose stabilization and lowered insulin when they start using dihydroberberine. I'm a huge fan of creatine. I've been a fan of creatine. I know it's coming back. It's all over social media right now, but I've been using creatine forever, and I think it's a great supplement for the vast majority of people to be on. Magnesium, I find magnesium is very helpful in kind of the metabolic realm. I like ALA. That's another one that we often combine in metabolic health for a supplement just to help with kind of blood sugar management. Chromium's another one that could get thrown in there as well, just as I'm talking more of a combo supplement. I'm trying to think what else. Oh, inositol. I often find myself, specifically for my women with high androgen, insulin-resistant PCOS, inositol works great, and it's completely safe during pregnancy, so you can continue taking it. Berberine, not so much, but inositol for sure. That's been a very helpful supplement to stay on as well, one I continue to use myself. I think that's probably the biggest heavy hitters. And then when I look at somebody for supplements, I typically spot treat based off symptoms and labs, right? So if I see somebody with maybe higher liver enzymes, a milk thistle and an NAC often does really good. If I'm specifically working with somebody that, may have low testosterone, not in the context of PCOS, maca root can be helpful, or high estradiol dim. So I really treat a lot of my clients with supplements based off of what their labs are saying. And then of course I use a lot of other things with, mental stuff. Like I use a lot of nootropics and adaptogens and some of your kind of newer things, but are extremely helpful as well. So it kind of just base a lot of the supplementation off of the individual's profile.
Yeah, targeted supplementation based on what they're dealing with. That's good. Let's lean into two of those a little bit more, because I think berberine, magnesium, chromium, even lipoic acid, I mean, people have heard probably quite a bit about those, but I'd like to ask you a bit more about creatine. Mm-hmm. It's been used by, strength and conditioning athletes for many, many years. But you're right, it is getting a lot more attention now, and then also inositol. So talk about creatine, like how it, what it does and how it might be beneficial for people.
Yeah. So yes. And I think I want to say about creatine too, a lot of people are intimidated by creatine because it has been such in that bodybuilding realm, and you can gain a little bit of fluid when you first start taking creatine. It's very minute amounts. It's like 1 to 3 pounds, and it typically resolves in the first couple of days. And so a lot of women are like, oh, no way, I'm taking creatine. But if you look at the published data on it, one, it's definitely not just for muscle building. It does a great job of putting on extra pounds via muscle and then losing some of that visceral fat as well. But it's extremely protective of cognition, and it's treating some of like your people that have had TBIs and things of that nature. And so it has a wide variety of treatments in the body. They're looking at ADHD, they're looking at basically a lot of the cognitive decline type stuff. So it's very cool the way that it works. In terms of how it works, I'm not like the mechanisms. You're probably well onto that, but I would encourage people to think about it. It does help with energy production in the mitochondria itself, and so a lot of people feel really good on creatine. They feel like their strength gains are bigger, or I shouldn't say bigger, but like they feel like they're more stronger in the gym. They tend to get over exercise or DOMs a little bit quicker, and so a lot of these things are really, really cool about creatine. And it's been studied for so long. We know it's extremely safe. Typically, what I recommend grams is around 7. Most supplements are around 5 per serving. So I typically do a 1 1/2 supplement. There is a loading phase. Some people like to do double the, for a couple days and then go back down to 7 grams. But I say all that to say a lot of people only think it's useful for people that are trying to get really bulky. It is not that at all. It's just been shown to help with weight loss, cognition, a lot of the things that I've already mentioned. So I'm a huge fan of creatine, and it's extremely safe, which is also important in this supplement realm too.
Yeah, no, that's great. And, inositol is one that I think is really important. It's been studied a lot with PCOS, but it helps resensitize cells to insulin, and therefore impacts your blood sugar. So I think it's one that not a lot of people are doing, but it's something that I think most people with prediabetes or insulin resistance should add, or at least try it for a while to see if it makes a difference in your insulin sensitivity and blood sugar.
For sure. And I have seen the most benefit. A lot of the symptoms that come alongside of insulin resistance, they tend to go down, obviously, because if you're more insulin sensitive, you'll have that effect. But especially women with PCOS, in terms of their cycle, pain around their cycle, a lot of the kind of physical symptoms that come with PCOS, like the oily skin, because it in turn is indirectly lowering those androgens as well. And so I'm a huge fan of it. It really should be mixed. A lot of people will buy just pure inositol. It really should be mixed with D-Chiro, 40-to-1 ratio. So there's a couple brands that do that. So I'd recommend, if that's something you're looking into, just make sure that it's going to be most effective in that realm. But yeah, I like inositol. It's great to take in the evening too. It kind of has a calming, relaxing effect. So a lot of people talk about improvement in sleep with inositol. And again, similar to creatine, it's extremely safe. And so you don't really, there's not a lot of drawbacks when you start myo-inositol in terms of having to worry about specific interactions or interactions with medications. It's safe with pregnancy, breastfeeding, all that kind of stuff.
Yeah, for sure, for sure. So a lot of times you'll see myo-inositol and the other one you mentioned, D-chiro-inositol. And so you want a product that has both of those. And you're right, a lot of those will follow the data, which shows sort of this 40-to-1 ratio of those two. So look for that if you're going to buy an inositol product. All right, fantastic. This has been amazing. We're getting close to wrapping up. So I'll send people again to your Instagram page, which is ketogenic.nutritionist on Instagram. A lot of great posts, reels, and things that you can watch there. And Temple, you do a great job of sharing information over there. So I'll send people over to check it out. Is there anything else that you want to mention about people finding you or things that people might learn from checking out your socials?
Yeah, I really appreciate you having me on, and I can be found, like you said, at the.ketogenic.nutritionist on basically everything. I give a lot of free meal plans and food guides and grocery lists and that kind of stuff. So if you're looking for just kind of an entry level, easy barrier or low barrier entry to this, please, go follow me. But it's been an honor, and I really appreciate you having me on. This was fun.
Good. So just one more question for you as we wrap up. What is one thing, like one piece of advice you give or a strategy that you use that you think is maybe underused, that maybe not a lot of other people are doing, or something that you talk about that you don't hear a lot of other people sharing, that might help people with blood sugar or insulin sensitivity, insulin resistance issues? Is there anything that comes to mind for you there?
I think the only thing I would say is that don't compare yourself. I think it's very easy to look at someone else's health journey, especially in the day and age of so much social media and looking at how someone else did things. I think had I stayed in this tunnel of what I was being told in conventional medicine and never thought like there's got to be more to this. I guess what I'm trying to say is like I believe in the body's innate ability to heal, and everybody's journey looks a little bit different. And so don't be afraid to try things as you learn about them. Don't be afraid to experiment. If something's not working, shift and change it. So I hope people leave with a lot of hope that a lot of the stuff that we deal with in modern times today can be fixed, can be healed, and your body wants to do that when it's put in the right environment. So that didn't make a whole lot of sense, but I hope it does encourage someone that, don't give up on wherever you are in your journey. You may mess up 100 times. My first year of following a ketogenic diet, I figured out, 17 different things that were high sugar that I didn't even realize. And I'm a dietitian. I'm literally trained to do this. And, and so if I had given up the first time I messed up, I would have never found myself where I am here. So keep trucking along, try things as they come, seek help if you need it or if you're frustrated. And anyway, leave with hope because your body can heal, and it will heal in a lot of cases, like I said, given the right environment.
Okay, awesome. Yeah, I mean, we're all so different, and sometimes a formula that worked for one person isn't going to work for the next person. So, you might have a friend who did diet A and got amazing results, but it doesn't work for you. Or maybe you just need to tweak it a little bit. So I love that. Personalize it for yourself and don't give up because you can do it. You just got to find that right combination of things that's going to work for you. So,
can I add one more?
Of course.
Okay, sorry, this is coming to me. I had wished I would have done this immediately. I wish I would have gotten a significant lab panel pulled. I think a lot of people push the ball down the road with getting labs, whether they're scared of the results, etc. And when I say get labs pulled, I mean like don't put yourself into debt, paying for these labs, but you can get a really good functional medicine in-depth lab panel for $200. And so please prioritize that. That would have alerted me to a lot of things that were just getting missed on these traditional kind of conventional medicine panels. And so I would encourage you, if you don't really know where to start, or you may have never done this, or you've only looked at what, your insurance is pulling year to year, prioritize getting Function Health, there's a zillion companies online that have a lot of options. So I would say that would be a first step as well.
Okay, perfect. All right, Temple Stewart, thank you so much for your time and your expertise here. Everybody check her out at the .ketogenic.nutritionist over on Instagram. Thanks, Temple.
Sure thing. Thank you.
Okay, take care, everybody.